So, you've got this brilliant, maybe even world-changing idea for a health tech app. That's amazing. But before you dive headfirst into coding, there's a huge question you've got to answer. How much is this actually going to cost? In this explainer, we're going to break down the real costs of developing a healthcare MVP for 2026, so you could take that vision and make it a reality.
This is it, right? This is the million-dollar question, or, maybe the $50,000 question, depending on what you're building. It's the number every founder, every investor, every single product manager in health tech has to get a handle on before a single line of code gets written.
But here's the catch. There is no magic number. I can't just give you a price tag. The cost of a healthcare MVP is a moving target, and it's shaped by a whole set of unique challenges and choices. So think of what we're doing here not as me giving you a price list, but as us building a blueprint together to help you navigate this really complex, but also incredibly rewarding landscape. Let me put it this way. Building a regular app is kind of like building a house. You've got a blueprint, you follow the steps, and you're pretty much done. But building a healthcare app, well, that's like building a hospital. You are dealing with life or death data, which means you need Fort Knox level security. And you have to find your way through this maze of regulations like HIPAA from day one. It is a completely different ballgame.
So what is it that makes a healthcare app so different from, say, a social media app or an e-commerce platform? Well, it really all comes down to 4 key factors that just drive that complexity and the cost way, way up.
First, you have these ironclad compliance and security rules you absolutely have to follow. Second, you'll probably need to connect with these clunky, older legacy systems. Think of them as the ancient digital plumbing that hospitals have been using for decades, like electronic health records. Third, you might actually need to prove your product works with clinical validation. And finally, you're not just designing for one person. Nope, you're designing for a whole ecosystem of doctors, patients, insurers, and they all have their own specific needs.
And right at the heart of that whole compliance challenge is HIPAA. In the US, it is the law of the land for protecting patient data. And this is so important, it's not something you can just tack on at the end. HIPAA compliance has to be baked into the very DNA of your app, from how you structure your database all the way to which cloud provider you choose.
Okay, so now that we kind of get why healthcare apps are so pricey, let's look at what actually makes them so expensive. We're going to deconstruct the budget and look at the 5 main levers that are going to determine your final cost.
First up is scope. What are the absolute must-have features? Second, compliance. Are you just dealing with HIPAA, or do you have the FDA or GDPR in the mix? Third, integrations. Do you need to connect with those EHRs we just talked about? Fourth is your tech stack. And finally, the really big one, AI and data analytics. And look, they all matter, but pay super close attention to integrations and AI. In our experience, those are the 2 that most often cause budgets to just balloon. This slide right here really drives home just how much your scope can blow up your budget. On the left, you've got a pretty basic telemedicine MVP. Straightforward stuff. But on the right, an AI-powered diagnostic tool. That is a whole different beast. We're talking predictive models, medical imaging, deep system integrations. The cost difference between these 2 is just staggering. All right, let's get to the good stuff, the part you've been waiting for. The numbers. Based on everything we've talked about, here are the estimated budget ranges and timelines you're looking at for a healthcare MVP in 2026. For a basic MVP, you can expect to spend somewhere between $10,000 and $50,000. This will get you a simple app with core features like a telemedicine platform with scheduling and video calls. But let's be clear, you're not getting any of those fancy integrations or AI at this price point. Now, if you're looking for something a bit more complex, you're going to need to budget between $50,000 and $150,000 for an intermediate MVP. This could include features like that really crucial EHR integration we mentioned, or maybe some basic AI for managing patients. And if you're building an advanced MVP, get ready to open up your wallet. The price tag here starts at $150,000 and can easily climb over $500,000. Now we're talking about a super complex platform with deep integrations, advanced AI, and absolutely rock-solid compliance. This is the big leagues. This bar chart really puts those cost tiers into perspective. Just look at the jump from that first bar, the basic MVP, to the second one for an intermediate MVP. You can triple your costs just like that. And the leap to an advanced MVP, that can be a 10-fold increase from where you started. This is exactly why it's so critical to define your scope early.
And of course, time is money, right? A basic MVP can be up and running in as little as 6 to 12 weeks. An intermediate one will take you closer to 3 to 6 months. And if you're building one of those advanced platforms, you need to plan for at least 6 to 10 months of development time, if not more.
Okay, I know those numbers can be a little daunting, but don't worry. A high price tag does not mean it's a dead end. There are definitely smart ways to manage your budget without giving up on your vision. So here are 5 really practical tips for optimizing your spending.
First, be absolutely ruthless about prioritizing your features. Focus only on what you need to validate your concept. Second, embrace agile development. Building and testing in these short cycles means you're constantly getting feedback, so you don't waste 6 months building something nobody wants. Third, use open source tools to speed things up. Fourth, use a HIPAA-compliant cloud platform like AWS or Azure. It'll save you a massive upfront cost on infrastructure. And fifth, don't be afraid to outsource specialized work like security or AI. It can be way more cost-effective than hiring a full-time team.
And really, that's the key takeaway here. An MVP is a minimum viable product. The whole goal isn't to build your perfect dream platform right out of the gate. It's to build just enough to prove your idea has legs, learn from your first users, and do it all without going broke. Look, your idea has the potential to truly revolutionize healthcare. But to make that happen, you need a budget that's just as strong as your vision. So the real question isn't just how much will it cost, but is your budget actually built to last the entire journey?